the next session, which is discussions regarding, you know, a summary recommendations from the executive summary of the policy brief. So I'll ask at this juncture two people. I'll ask Madam Carolyne and Madam Lilly. Madam Carolyne Maholo is the honorary treasurer of the CBR Africa network. She's an executive member of the network, and she's part of this CGN team. And also Madam Lilly is from India. She belongs to the India Alliance for Child Rights. So the two of them, I'll say over to you now, Madam Lilly and Carolyne, to moderate the discussions on the ask and the recommendations.
The ask has got 10 points extracted from the call of action in the Rehabilitation 2030 agenda. The first point, and it's important that we listen to this carefully because we are going to make certain contributions to the recommendations that are available so far, so that we have a contribution from Africa to this aspect in the advocacy for CBR. The first point is creating leadership and political support for rehabilitation at subnational, national, and global levels. The second call is strengthening rehabilitation planning and implementation at national and subnational levels, including with this emergency preparedness and response. The third one is integration of rehabilitation into the health sector and strengthening intersectoral links to effectively and efficiently meet the population needs. Now, all these aspects relate to all our work in the disability and rehabilitation fraternity, and it's important that we make tremendous contributions to ensure that whatever is provided suits our respective context in Africa and other developing countries. And that is why we have Asia joining hands with Africa to contribute to all this. And it's one of the reasons we are here now. The fourth point is incorporating rehabilitation into universal health coverage. Number 5 is building comprehensive rehabilitation service delivery models to progressively achieve equitable and affordable access to quality services, including assistive. The fifth one is building comprehensive rehabilitation service delivery models to progressively achieve equitable and affordable access to quality services, including assistive products for all population, including those in rural and remote areas. Number 6 is developing a strong multi-sectoral, multidisciplinary rehabilitation workforce that is suitable for each country context and ensures rehabilitation as a topic to be included in all health workforce education efforts. Number 7, expanding financing for rehabilitation through appropriate mechanisms. Number 8, collecting information relevant to rehabilitation to enhance health information systems, including system-level rehabilitation data and information to functioning using the International Classification of Functioning, Disability and Health. Number 9, building research capacity and expanding the availability of quality evidence for rehabilitation. And number 10, establishing and strengthening networks and partnerships in rehabilitation, particularly low, middle, and high income countries. The first point is creating leadership and political support for rehabilitation at subnational, national, and global levels.
Dr. Oswell Kondoe from Zambia, could you please give your remark or question? Thank you.
The first point, find out if there's a specific reason the way the sentence has been structured is starting from subnational to global level, not the other way around. Usually of global, national, and subnational.
I cannot give a reason because it is written by WHO. Subnational means probably they mean district or region, then national, then global. Yeah, basically look at political will, political leadership to promote rehabilitation. That's what it is. But if you want any clarification, say, look, sub-district has to be, sub-regional should be district or sub-district, something like that. In that, we can add.
Odifax Kamala from Tanzania. I'm glad to join you, and I would directly go to my contribution on the point number 1 on creating strong leadership and the political support for rehabilitation at subnational, national, and the global levels. I would like to just advise or seek, technical advice from you on how to put this into practice. Yes, we are going to call for action for this for this point to materialize. But historically, we have been having this. Our political leaders, our policy implementers have been, sometimes they are aware, aware of these things. But when it comes to implementation, you find a problem, So I would like to ask probably how are we going to make sure that it's not just creating strong leadership, but also a commitment, that when they are making such promises, they eventually implement them. So I think there is something to do there, because once there is the political will and there is implementation, then in all other points from number 2 to number 10 can easily be implemented as well.
Yes,
thank you very much. My name is Atigo. I'm listening from Kenya, and mine is just a quick one on the, now that we know that the COVID-19 realities, and I was looking for a point specific on innovation in rehabilitation and health, especially at this time when we realize that a pandemic can put everything to a stop. And of course, our area of work, rehabilitation and working with disabilities, the challenges that already come with our platform is. So what additional call for action do we have based on the current realities and innovation moving forward, knowing that this is something that is here with us? And I'm not talking of COVID, emergencies and pandemics coming in the future. So do we have something in mind? Thank you.
Okay.
I just want to respond. So saying yes, we need commitment of political leaders do things, but they don't implement. Well, the only thing that we can do, what we have learned, is to go on advocating, and also now the 2018 report on the burden of disease on rehabilitation says that 1 in 7 people in the world need rehabilitation, some form or other, sometime in their lives, which means disabled people's organizations, persons with disabilities, whichever you call, we need to build alliances with groups of women, groups of older people, groups of people working with children's rights without disability, because they also need rehabilitation. And we have to increase the our advocacy by joining hands, by inviting other people to join in our advocacy. So that the greater the number, the greater the chance of influencing governments to provide more money for rehabilitation. As Mr. Maholo and Chan rightly said, under those, rehabilitation is not a priority, all that said. This has to change. Then we need to advocate, we need to increase, and we need to build alliances with other groups of people who need rehabilitation. There is no other way. There is no other secret to this.
There is a hand raised by Glory Chiazie. Glory.
Yeah, greetings to everyone. My contribution is based on point number 3. And I think we started by reminding ourselves what a CBR is, which is actually a multi-sectorial approach for the equalization of opportunities for persons with disabilities. And so if we are talking about integration, let us not only be focused on the health sector, because persons with disabilities or children with disabilities, in the education setting, they need rehabilitation. In the livelihood setting, they need rehabilitation. And I mean, in most of the sectors in which they find themselves, they need rehabilitation. So I think that we need to have an integration, a multi-sectorial integration of rehabilitation. I know that our focus is on health, but I think we should have that bigger picture in mind, so that, I mean, health can now be integrated into the other sectors, so that the rehabilitation needs of persons with disabilities can actually be addressed across. Thank you.
Yeah. I have a comment on number 3 and as well as number 4. Something is similar to my sister who have been talking before me. In general, I feel that the rehabilitation component is very much, we are very much pushing it to the health sector. I know the greater part is more linked to the health aspect, but when we talk of rehabilitation, it is a joint job. It's a joint work with different professionals, like, Ministry of Education and the Ministry of Labor, and the other sectors are very much important. So we are just, leaving aside the other stakeholders who are very much responsible on the part of implementation of rehabilitation. I have this kind of concern and this ask point, as well as on the resolution in general. It's more of it's very much organized resolution paper. I really appreciate that. It's hard work that's put in that on that, but it's very much pushed towards health. So I have a concern. Thank you.
Peter Mwasia from Kenya. My contribution is on number 2. In addition to strengthening rehabilitation planning and implementation, I think we have a major challenge across the board in terms of coordination, because experience-wise, I think there's a lot that is happening in many countries here and there, and more particularly also in Kenya. But when it comes to the right channels of coordinating what is happening and reporting what is happening in any country, that bit I see a challenge, and that's an area that may need to be looked into in terms of strengthening. And then overall, listening to what has been raised in a few those few areas, I think overall each country may need to sit down and translate the call for action by WHO on rehabilitation to 2030. And maybe each country could come up with position papers on the way they understand it and the way they, they think could be implemented within the country and then be included in planning and reporting. Thank you.
Some to shed more light on point number 3, I think it was number 3, that was on integrating rehabilitation into health sector. I was, in my opinion, I think if you read that point, first of all, it asks, it reminds us to integrate it into health sector just as a point of departure, just as the starting point. But if you read through the whole sentences, it is followed by, I think it is integrating it into other sectors. I think that's where now education sectors, livelihood sectors, and other sectors would emerge. But the point of breakthrough, the point of meaning of starting should be in the health sector. So I think I support the point as it is. I think in point number 3, I think it is just well written, and I just I would like to leave it as it is, because I think it captures well what other people have been asking about.
First of all, here rehabilitation health are being seen from a health perspective. But if you see where the whole idea of the Alma Declaration of 1978 and the IFRA Declaration of 2018, health is not the absence of disease, absence of disease. Yeah, it's well-being, overall well-being of all people. So you see, health, the health determinants of health, the socio-economic determinants of health are education, livelihood, leisure, recreation, relationships, justice, peace. All of that together is the well-being of contribute to well-being of people. So what is missing this 10 points is looking rehabilitation from a tunnel. It's a tunnel vision of rehabilitation. So that is why if you see the CBR guidelines addresses the socio-economic determinants of health. And therefore, we come back to the thing again. The role of CBR, Christy made very clear in a presentation. Rehabilitation is not it is not an end itself. It is the beginning of a process of inclusion, which means inclusive. It needs to be looked at holistically, addressing the socio-economic determinants of. So, in effect, all of us saying is, I'm trying to sum up what you had said. Another thing is important thing to remember is the disability community. You may get after the disability community is insular community. It isolates itself from other marginalized groups. It is focused only on its own interest of inclusion, rehabilitation, discrimination. If disability community only were to engage with other groups who are marginalized. So, you see, for example, in a community, people may be about not having water. Where the disability community, I have not seen many engaging with the non-disabled community who are struggling, who are advocating for better roads, for better housing, better schooling. They are only focused on disability issues. Therefore, we need to look at ourselves as a community to see how we can be more inclusive of others. We will be included, but we need to be inclusive of others, because inclusion is a true process. It's not one way. So, if you want to ask any clarification on what I said, I'm to offer. In so long as we are insular, we will remain isolated, we will remain excluded. We may talk about inclusion, but we can only include ourselves. Others will not include us. In so far as we will include.
This was the slide that was a follow-up. Just to clarify, the earlier document that we were discussing was something that the WHO had put together in 2017, and they're calling for action. And many of the points that you have made works towards asking WHO to take forward. And somebody mentioned the issue of the point of implementing many of these very lovely sounding sentences. So that was that. And based on that, CGN and IFRA members, they endorsed these activities that was suggested in the call for action, WHO's document, that CBR to be universally applied across countries, not limited to pilot projects and limited geographical treatments. Systems to deliver CBR need to be established and aligned, and to make best use of DPOs, community volunteers, and home-based carers to expand the workforce, delivering appropriate skills to these cadres. CBR must be included as an integral part of service delivery, especially within PHC, UHC, and hence in any resolution, including the one on attaining highest standard of health for persons with disability.
Highest attainable standard of health for persons with disabilities expected to be adopted in the World Health Assembly in 2021, and rehabilitation from expected to be tabled in the World Health Assembly in 2022.
Yeah, this is Peter Kimbonyi from Zambia, the Down Syndrome Foundation of Zambia.
Okay.
Yes, thank you so very much for this meeting and for this gathering and for the sharings and for all the contributions. This is very encouraging and very important. I have a few things to mention and to contribute and to bring to the fora. Firstly, I would like to mention that you see issues of disability, especially on the African continent. There is variance in political wills coming from various governments towards disability issues. So I think the most important thing that as advocates, disability organizations, and all those involved in advocating for the improvement of quality of life for persons with disabilities, including rehabilitation, number one is to make sure that we put it as a priority to make sure that our various governments understand the value of persons with disabilities. Because you see, you have disabilities that are still struggling for recognition on the African continent. When I say like this, I mean intellectual, psychosocial disabilities in certain African countries, they are still struggling for recognition. Government doesn't understand. Certain governments don't even have an idea about these disabilities. They focus mainly on what I call the traditional disabilities, okay? Visually impaired, physically challenged, and deaf or the hard of hearing. These other intellectual disabilities, they're not counted. So you find that even in the service provision, in the health sector, in the educational sector, you find that even when it comes to training teachers of special education in universities, in colleges, you find that their syllabus, their course content mainly focuses on these three disabilities I've mentioned. So number one is to emphasize that disabilities are holistically handled as all disabilities, because there's no bigger disability, there is no smaller disability. So that's point number one. We have to make sure that the voice is holistic when we speak about disabilities. Number two is to make sure that government itself, we advocate, because you see the other challenge we have is disability organizations. They speak as individual disability organizations, but what is important is, as disability organizations, you know, when we are advocating, we must speak as one strong voice to make sure that government listens from all of us. it is going to become easy for the governments to listen to that one big, strong voice, especially as we are heading towards inclusion, as we are talking about rehabilitation. We have to make sure that, as advocates, we make sure that we fit into the government system, and the government system also taps from what we have on the table. If we speak as individual organizations, governments will not listen to that small voice. We need to speak as disability organizations wholly and holistically, then it will make sense. So if government begins to understand the broader...
Sorry, we are running out of time. Please write mail on this detailed description of what you are saying.
Okay.
And we are saying what you are not valuable, but talking CBR, the recommendations we are making on CBR. So if you don't understand, because we are supposed to close 10 minutes ago, and we are running out of time.
Let me type it in the chat box.
Just the point you are saying about persons with severe disabilities and multiple disabilities is covered in the recommendations in 18, I think 6, 7, 8, 9, I think it is there that people with disabilities we give recognition that's being included. So don't mistake me because we're running out of time. I thought
the point Venkatesh makes and points that were just made very valuable and I think very important. If you could put it down for us on a piece of paper, send it to us. Yeah.
Okay, I'll put it in the chat. I'll put it in the chat box.
To be precise, CBR issues are very crucial for the marginalized and also persons with disability in our community, our various communities across the African continent. Government, to engage, to proper engage government, for government to look at this well-crafted point, of course, we also need to assess our own individual countries, where we are coming from, our needs assessment with respect to the challenges that have saddled the health services, inability to access health services, especially for persons with disability over the years. So in order to do this, I think, of course, we need to build a strong force using the country representations on the CBR African network, and of course, working with the teams of our individual country to look at this properly. And before, of course, we can engage government for an intervention on all these areas that we've spoken of. Other than that, of course, government may have his or their own agenda, political agenda. Some of them have their short, long-term agenda, in order to infuse and to reconnect what we expect government to do for us. We need to study this document carefully and find an approach, a comprehensive approach, which we will all speak with one voice to engage government to act upon this. So definitely, I think they are well-crafted points, and of course, they are all in the right direction for our work. Not to speak, man. Thank you very much.
All right. So thank you so much for the presentation and the comments.